Vaccinations. Before your veterinarian discusses specific vaccines for your family pet, an overview of vaccinations will be given to help you understand why they are used and how they work. The primary purpose of a vaccine is to stimulate the immune system to produce protective antibodies against a specific infection. The antibodies formed will offer protection in case of real exposure to the infection. The goal of a vaccination program is to safely deliver a vaccine that produces a strong and lasting immune response. All vaccines contain antigens. Antigens are substances that stimulate the immune system. The antigens found in most vaccines are viruses and bacteria. For purposes of vaccination, the viruses and bacteria are modified in different ways to provide protection without causing disease. There are three general types of vaccinations used in veterinary medicine: killed, modified live, and recombinant vaccines. Killed vaccines contain antigens that have been inactivated to reduce the antigen's disease-causing ability. This inactivation allows the vaccine to be placed safely in your pet's body to produce a protective immune response. Modified live vaccines contain live viruses that have been genetically altered to stimulate the immune system but not cause disease. The benefit of a modified live vaccine is that it more closely mimics an actual infection and tends to provide stronger immune protection. The third category of vaccines is recombinant vaccines. Recombinant vaccines contain only the immune-stimulating pieces of viruses or bacteria. These new vaccines provide excellent protection against infection and improved safety over the other two vaccine types. The type of vaccines that will be given to your pet will depend on their age, health status, lifestyle, and geographic location. Vaccines can be given under the skin, in the muscle tissue, or as drops in the nose. Vaccinations should always be administered by an animal healthcare professional, as problems can occur if the vaccine is handled or delivered improperly. Adverse vaccine reactions do occur and cannot be predicted. Remember that along with the vaccination your veterinarian is giving, you are also receiving their invaluable professional advice and care. Puppies and kittens require a series of immunizations because of the potential presence of maternal antibodies in their bodies. These antibodies, passed through the mother's first milk, provide puppies and kittens a level of instant, short-term protection from common infections. Maternal antibodies can persist for 14 or more weeks in the young animal system and interfere with the immunization process. There is a window of time when the young animal's immune system is maturing and the maternal antibodies are waning. This time period is when young animals are most susceptible to infection. Giving booster vaccinations every 3 to 4 weeks during this window of time is key to stimulating the maturing immune system to allow the best protection while the maternal antibodies diminish. It is important to realize that vaccination of your pet does not provide immediate protection. The immune system typically requires up to 14 days to mount a maximal response and to produce adequate levels of protection. Because of this, dogs and cats, especially puppies and kittens, should not be placed in exposure situations until they have completed their vaccination series. While uncommon, vaccine reactions do occur. Mild reactions include irritations at the injection site, such as swelling, pain, or formation of a knot. Some pets, especially puppies and kittens, may experience a reduced appetite and activity level for 12 to 24 hours following vaccinations. If your pet experiences any of these signs, treatment may not be necessary, but you should notify your veterinarian. Moderate reactions that require veterinary care include facial swelling, noisy breathing, hives, which are itchy bumps on the skin, and persistent mild reactions lasting more than 24 hours. Signs of a more severe reaction include vomiting, diarrhea, difficult breathing, profound lethargy, or collapse. If your pet shows any of these signs, it is an emergency and immediate treatment is required. Fortunately, most of these reactions happen while you are still at the veterinary clinic and help is close at hand. Vaccines are considered safe for healthy pets. However, in some cases, individual pets with underlying conditions may experience problems when a vaccine is administered. Before vaccinating your pet, your veterinarian will discuss your pet's lifestyle and medical history with you. Pets with a history of an adverse reaction to a vaccine or who are immunosuppressed should be vaccinated with caution, if at all. Your veterinarian will discuss any alternatives to immunization with you to keep your pet healthy and protected. Keeping your pet properly vaccinated is very important. Your veterinarian will recommend appropriate vaccine and booster schedules and will send you annual reminders to ensure your dog or cat remains protected.